Excellent afternoon, everyone. Excellent afternoon to every one of us. We are all welcome to this afternoon's broadcast. Sorry once again that I could not make it exactly by 1 p.m. I had, like I told us, I'm on a trip, and so I will make sure I'm with us every day that I'm supposed to be online, but sometimes because of the long trip, it might not fall into the time. So anytime I have to change it, I will announce. But I'll try as much as possible to keep to the normal time of 1 p.m. on Monday, 1 p.m. on Thursday, and 9 a.m. on Saturday. But peradventure, I can't come in at that particular time. I will let us know. So we're all welcome to this afternoon's broadcast. This afternoon again, we're going to be looking at the disease they call fat. It's not a laughing matter. Because, sometimes some things we take for granted are not really what it's supposed to be. So I'm going to share this on my page, and then we get going this afternoon as we look at that disease they call fat. Excellent afternoon. You can greet if you have joined me, and then I'll welcome you to this afternoon's broadcast as we look at Lipedema, that disease they call fat, Lipedema. So that's what we're looking at today, and I came across it when I was searching for, we are treating arms fat this period. For a period of 2 weeks, 3 weeks, we're going to be looking at arms fat and all the things we need to do concerning our arms fat to trim it down, and make sure that we live the best. So as I was searching and asking myself, so why should I even be bothered about this arms fat? What's so much of importance about it that I should be thinking of how to trim it? Can't I just go ahead and just sew clothes that can just cover it, and that will be it? But then I now found out that it's not just ordinary. A lot of us are interested in our weight because of cosmetics, but I want us to go beyond cosmetics. Hello Fumi, you're welcome to this afternoon's broadcast. Excellent afternoon, Abimbola. You're welcome. Thank you for joining me as we look at that disease called fat, Lipedema. That Lipedema disease that they call fat. It's a disease that occurs with fat. We're going to be looking, at it very, very well this afternoon, and all the causes, the effects. We're also going to be looking at what can you do to prevent it, so that if you have anybody suffering from it without even knowing, or somebody that wouldn't even know that that's what is suffering. Because sometimes, like menopause, you are going through menopausal symptoms, you go from one clinic to the other, they don't even know what you're going through. Hello Fumi, I miss you a lot. I miss you all a lot to Nigeria. In fact, I miss Nigerian food so much. When you have something, you don't know how good what you have is. For these past few days, I'm like, hey, where is my eba? Where is my gadiega mala? Where is my soup? Vegetable soup or noodle soup? I'm missing them. Hello, Angie. Excellent afternoon, Angie. You're welcome to this afternoon's broadcast as we look at the disease they call fat. That's what we are looking at today. I'll soon finish sharing it, and then we can go ahead and look at it today very, very well. All right. Yeah, okay, welcome Fumi. All right, so we are all welcome. So in the poster I posted, advert I made for this broadcast, you would have seen the legs of four different types of legs that I posted. It's the same woman, and that's the stages of Lipedema, and we're going to be discussing it today. Stage 1, stage 2, stage 3, and stage 4. So what exactly is Lipedema? It is a fat disorder that is primarily found in women. We women, God has blessed us with good things, and so we need to watch it too. And it causes fat deposits and pain, like in the upper arms, the hips, and the thighs of women. If that word Lipedema just means fluid in the fat, that's like fluid. You can use water, or fluid can be water, it can be anything. Fluid in the fat, and that condition is also called painful fat syndrome. These are the 3 ways they can actually explain it when you go to meet doctors of the way you feel about it. It's either painful fat syndrome or fluid in the fat. You know, due to its common confusion with obesity, overweight, lipedema is also known as the disease they call fat. Because, you know, ordinarily, when somebody is overweight, it's not like a disease. It's just maybe, okay, it might cause some diseases. But then, when it now becomes a disease, that's when it's lipedema. And that condition is often misdiagnosed by several medical, personnel. But still, it affects over 350 women all over the world. So you can imagine a disease that is dealing with over 350 women. And because it has different stages and different symptoms for different people, that's why it's actually not so well known. Hello, Julie, you're welcome. Welcome, Christiana. Afolabi to this afternoon's broadcast as we look at this disease they call fat. Now, generally, lipedema presents as a disappropriate distribution of fat, creating a similar upper body. Your upper body will be smaller than your lower body, depending on the area. Like I said, there are different areas which we're going to be looking at that it occurs. So, like for people who have it in their upper arm, remember we are looking at this week and next week I have a chat room where I'm teaching us on how we can reduce our arms fat. So by this evening we are starting our housekeeping and logistics before we start by tomorrow morning with the exercises, change of diet and things like that. And that's what brought me to this. Because as I was studying, I found out that there are some people who it's not just ordinary fats that they are just fat, but they have this disease called lipedema in their upper arms. So when somebody has it, the person will have different types of body. If it's in the lower trunk, the upper trunk will be small and the lower trunk will be so over, weight and looking very, very funny. So, and people who have it, they try their best to lose weight. They put in diet, they put in calorie counting, they put in everything about losing weight. They find out even exercises that they can't lose that weight. So nothing seems to work for them for long to reduce that pain, to reduce that weight, and to reduce the swelling. Thank you for the love. Thank you for the hearts. Welcome, Fajina. Let me welcome a few people. Welcome, Marianne. You're welcome to this afternoon's broadcast. Welcome, Esther Samuel. Happy birthday, Esther Samuel. I hope you saw me saying happy birthday to you. Yesterday was your birthday. Welcome, Abiola. And welcome, Ruth, to this afternoon's broadcast. We are looking at that disease called fat, and that's lipedema. So, ultimately, that the person suffering from it will have issues with, trauma. It will become traumatic, and then the person will continue going in deeper and deeper into it. People always confuse lipedema and obesity, and the relationship between them is quite complex. Today we will look closely at why lipedema is often confused with simple obesity. Then we also look at what events that triggers that condition. Then we're also going to distinguish it with another disease that resembles it so well, which is the lymphedema. And then we will now look at the two, compare the two. And then we'll also look at some treatments that medicine gives and some natural remedies that you can use for prevention, for management, and apparently, if God being on your side, the person will be healed of it. So what is lipedema again? Women with lipedema frequently feel like they have two bodies. You know why? Because they have a typical upper body, chest and abdomen, but at their waist and below their lower half of their body, it's unproportional. You will wonder if it's the same person. And they often have difficulty finding clothes that will fit them because, when they say size 12, if they are size 12 in their upper trunk, lower trunk might be size 20 or something like that. So it's difficult for them to find clothes that they can wear. And it also occurs almost in women. You hardly hear of it in men. And around the time of the first menstruation of a woman, that's the time the person is prone to begin to have it, or during pregnancy. And then if it doesn't occur during pregnancy in some of the women, then some it's later in life, like during menopause, when they have all those hormonal changes, you know. So it's not a disease that has not been. It has been since they've discovered it since 1940s. But the only thing is that they've actually not found a very definite solution that they will say, okay, go and take this pill. When you take this pill, then you're out of it. And that's why we need to watch ourselves. We need to watch our weight. We need to watch our diet. We need to watch our lifestyle as women, because it's very, very important. You can't joke with your diet. You can't joke with your lifestyle as a woman. It's very important that you watch your lifestyle. So what triggers lipedema? Let's look at it. You know, what actually brings it? You know, it's actually thought to be a hormone-based disease, occurring almost, like I said, exclusively in women only, and actually during the times of their hormonal changes. Remember what I told us. If you go down my page, you'll read a lot about menopause. I've even handled menstruation at one time or the other. You know, because of the hormonal imbalance, because of the hormonal changes in us as women, that is what brings about lipedema, especially during those high intensity hormone change period, like puberty, like pregnancy, like peri-menopause and menopause, and also if one goes through any kind of gynecological surgery or trauma. Then it could also be actually said that it occurs in some women naturally, genetically. You know, a woman might begin to develop a condition shortly after the onset of, you know, of her or any of these experiences of puberty, pregnancy, menopause, peri-menopause, or when the person goes through one kind of surgery or the other. Now, what causes it? The exact cause of lipedema is still unclear, and they are still researching on it. That's the issue with it, because, you know, it develops during hormonal influence stages of life, and so it is hormonal in nature. There are still a lot of researches going on. They've really not found out why, but women have it, like I said, when they reach puberty, women who have given birth, women who have reached menopause, and women with history of it in their family. You know, so when you usually, if you have any family member that has ever had lipedema, then you need to watch it. You need to actually watch it, because it could occur. Hello, Modupe, you're welcome to this afternoon's broadcast. Welcome. We are looking at that disease called Lipedema, and we've, you know, because there's a lot to say today, I'm not going to go through over and over. We can watch the replay. So to clear up common misconception, it is also vital to know that symptoms and conditions are different from lymphedema. Of course, lipedema and lymphedema. So lipedema is not the same as obesity. It's different. You know, you see some women, they are really overweight, and that weight, they don't have liquid, they don't have fluid in the fat. It's normal fat. You know, so when somebody is overweight, it's not lipedema. But lipedema can create, you know, an average body mass index of more than 35. Even if the person's body weight is not up, the body mass index is not up to 35, but because of that fluid in the fat, the person it now makes the person BMI to become like 35. Then also, lipedema is not associated with high risk of diabetes or hypertension. Those ones are obesity that can bring that. And then it's not also the same as lymphedema, because it can progress to become lymphedema. So that's the thing about it. So lipedema is also confused with lymphedema. Although lipedema and lymphedema have some kind of symptoms that are related, they are not the same. Now, the primary way they differentiate the two is that lipedema is fat-based disorder, while lymphedema is fluid-based disorder. So these conditions have a relationship with one another, but they are not the same. So one is fat-based, the lipedema, that's why they call it the disease called fat. But lymphedema is mainly fluid that is in it. And today we're not looking at lymphedema fluid, we're looking at that lipedema, because most women, you will see it on their upper arms, you will see it in their thighs, in their hips, and you know, you will also see it near their ankle, those fat will fold, and they look, you know, very, very funny. So we're going to look at the symptoms, and then again the symptoms differ according to the stage. There are 4 stages which we're going to look at today, but we will look at the general symptoms, and then we now look at each particular symptom for each of the stages. So the most common symptoms is excess fat fluid in the arms. There are some women, when you see their arms, it will be so bulky, it will look so funny, you know, even though they don't like it. It will bulge out in a very, very funny way because there are fluid in the fat. So, and then some have it in their arms, like I said, their hips, and then their thighs. Then they will have noodles of fat that can be felt under the skin. When you touch the skin, you will feel, you know, as if you're touching some small lumps of fat in it. And then a body that appears normal on top, but it's quite large from the waist downward. Their body upper trunk will appear normal, but from waist downwards they appear very, very abnormal. And then they have pain, they have tenderness in the fatty part of their body, and inability to reduce that weight. You know, you hear some of them say, we have done everything, we have done this, I'm on diet, I'm not eating much, I'm doing exercises, I'm walking, but they are not losing that weight. So that's part of the symptoms, inability to reduce your overall weight despite every effort on calorie restriction and exercises. Then there is the skin pitting, where the skin has dotted and uneven textures. You know, the skin will look very funny. Of course, normally when you look at the normal skin, it's smooth and nice, but those ones, the skins will look dotted, very, very, you know, uneven texture. And then the feet will seem unaffected though, but leading to a cuff on the ankle. When you look at the ankle, you will see something that looks like a cuff, you know, cuffing in, and fatty overhanging on their ankles. Then inside, they can also have what we call capillary fragility, including, you know, being bruised easily. So they are easily bruised. It's like a waterproof that is filled with water. You know, it can easily burst. Hello Rita, welcome to this afternoon's broadcast. Thank you for greeting. All right, we are looking at that fat disease called fat, the lipedema. So like I said, there are 4 stages of lipedema. The first stage is stage 1, and in this stage 1, the skin surface can be smooth with, you know, enlarging subcutaneous fat tissue, you know, just under the skin and between the skin and the muscle. That's where you feel, you know, you can feel your skin. Under your skin you have your muscle, but these ones between their skin and their muscle, they have that kind of fat. And remember what I told us when I was treating visceral fat. You can go and watch the video concerning visceral fat. You know, no, there can also be swelling that comes and goes depending on various circumstances. Like those fats that you see in between their skin can come and go depending on the type of nutrition they are taking, depending on weather condition. And then they can also have one kind of, I wish I can show you my leg. I can't raise my leg here now. They will have one kind of cuff, like flat fat that is folded around their ankle. You know, so then they have the stage 2. In stage 2, the skin surface is now beginning to become uneven. Stage 1, the skin is even, but stage 2, the skin is becoming uneven. And there can be also development of the noodles in the subcutaneous fat tissues, feeling like beans in a bag. This one now, it will not just feel like, you know, some smaller kind of fat in between the skin. This one will look as if somebody puts akara, and then you see lumps that looks like akara under somebody's skin. You know, that's how I can actually explain that. And you know, they will now have a visible dimpling of the skin, and there can be increasing tenderness and pain. The skin will be soft because of the fat and the pressure on it, and it will be painful. They will still also have that cuff, you know, that folding in their ankle. Then they have the stage 3. You can watch the advert I put the stage 1, stage 2, stage 3, and stage 4, you know, of the legs in the advert that I put up for us. In this stage 3, the skin surface becomes increasingly indented, and then the deformation caused by the fat growth. And there can be large masses of skin and fat creates folds and overhanging, especially at the hip, the ankle, and the knees. You know, you will just, this one, when you look at this person, you will know that something is wrong with this person. You will immediately know that something, and then the pain and the tenderness will become so much, you know, during this stage, and it becomes very, very difficult for them to move. That's the stage you see them walking with walking stick or pushing, you know, some things, and some women will just remain in one place. In fact, there are some cases I've seen that are really very, very pathetic. And the last stage is the stage 4, and in this stage 4, the progression of the lipedema advances to include significant compromise of lymphatic system, resulting in lymphedema. So this one now, we now include lipedema at the advanced stage, having fluid in the fat, having fluid in the in the body, and this stage is also referred to as Lipo Lymphademic, because it doubles them. So there are lobules of skin and fat, and then the thighs and knees everywhere becomes almost, the person can't move. The swelling becomes so persistent, and you know, the cough on the ankle becomes so much. Some people at this stage are just being carried. Even when they go from one place to the other, they are being carried. And these things progress. Lipedema progresses from stage 1 to stage 2 to stage 3 to stage 4. And that's why it's good to note it on time, handle it on time, and have some kind of lifestyle changes that can help. Thank God for medicine. Thank God that there are solutions, and thank God that there are ways that one can actually handle this, which we're going to be looking at this afternoon. So they have also 4 types of lipedema. Oh, sorry, they have 5 types of lipedema, which are divided according to the region or regions of the body that are being affected. Hello, Buki. I can see Buki coming online. Welcome to this afternoon's broadcast, Buki. And welcome, Emma. You're welcome to this afternoon's broadcast. We are all highly welcome. So the stage 1 is the buttocks. It starts with the type 1, I mean, not stage 1. The type 1 is the buttocks. Okay, I wanted to be sure I greeted everybody. Welcome, Flora. Welcome, Emma. Welcome, Buki. All right, so this type 1 is on the buttocks. You know, there are fat deposits mainly on the women's buttocks, accumulating, you know, sometimes occurring like a saddleback formation. So that one, the buttocks, we have one kind of fatty, you know. Usually for women, when they are adding weight, when you look at the buttocks, you'll find out that there's a way it looks. But many times it goes from overweight, it goes from obesity to become Lipoedema, and it starts with the buttocks. The type 1 is the one that is only on the buttocks, and you will see all those folds I explained on around the buttocks. Then the type 2 is the one that happens on the buttocks, the hips, and the thigh of the women. And fat deposit is concentrated on the buttocks, the hips, the thigh, and also on the knee. And the calves and ankles are unaffected by this type 2. Then the type 3 now goes on to from the buttocks, the hips, the thigh, and then the calves, our calves. So fat deposit is concentrated in the hips, the buttocks, down through the thighs, and into the calves to the ankle. And there is often, you know, but not always, a cuff at the ankle. And then the feet are spared. It doesn't, you know, occur on the feet. Then the type 4 is the upper arm, you know, which is actually what brought me into this. Fat deposit is concentrated in the upper arm, and this type 4 usually accompanies type 3 in some but not all the cases. You'll find out that those people that it was already started, you know, affecting their arms, many of them, their lower part of their body will also have all this, you know, fat. Hello, Ekoja, you're welcome. Welcome, Kemi. Welcome, Queen Blessing. Welcome, Oluwa. Kemi. Welcome, Chidi. Vivian. Welcome to this afternoon's broadcast as we look at that disease called fat, the Lipedema. Then the type 5 is the calf, knee, and ankle. So fat deposits the position is concentrated in the calf, from there to the knee, and then the ankles, pairing also the feet. So there is often but not always the cuff and the ankle. So these are the 5 types. Remember what I said? Type 1 is on the buttocks, type 2 is the buttocks, the hips and the thigh, type 3 now enters into the calf, type 4 the upper arm, and type 5 the calf, ankle and the knee. So now, one thing about lipedema is the pain and the bruising that comes with it. You know, usually pain accompanies lipedema, but each person can experience this pain in a unique way. I hear a number of women calling me to say, I don't understand the pain on my hand. It goes from, you know, my shoulder all the way to my ankle. That's what they will say. I've gone to the hospital. Good evening, Enoeti. How are you? Welcome to this afternoon's broadcast. Thanks for joining us again. And they will say they've done everything. They don't know what is happening to them. They can't just explain it. You know, some of them is lipedema they are suffering from, but they don't know. So one woman's level of pain may be different from another woman's level of pain, depending on the stage of the lipedema, and also the location of the pain varies depending on where, you know, which of the types the person is suffering from. And in fact, it's not even every woman that has that the lipedema comes with pain. You know, and pain level might change to becoming more or less during different types of time. So, and that's why it's so difficult for them to actually pin down why and what to do about this, because it varies from woman to woman, just like menopause. Menopause varies the type, the symptoms, the combination of the symptoms. They are all different from one woman to the other. You know, some of these things that they can't really say this is how it happens. It's so difficult to find solutions for them. So one will keep trying, medicine will keep trying one way or the other to see if they can find solution. So those who experience pain report that it occurs primarily in the areas of that increased fat deposits, and generally between the hips and the ankles. That's what they say. And there is also bruising with minimal or barely, you know, trauma. It becomes traumatic for them because almost every little thing that happens to them, their body bruises. And also it's a common, you know, it's common for them to see some kind of black and blue bruises along the thigh and calves, you know, with people who have lipedema. That's another way you check. I can remember one time we visited the clinic, and the lady I went with was just saying that she can see some kind of clots or something, and the doctor said they need to go and do tests. So when you see strange things happening to you, things you haven't seen in your body before, it's always better to report. Remember, prevention is better than cure. And even when something has occurred, if it's at the early stage, one can actually handle it and make sure it's okay. So when you begin to see some kind of black and blue bruises along your thigh, it's better for you to report so that one can watch and find out what is happening to it. All right, so we're going to look at, after looking at this, we'll look at how do you handle and manage lipedema. You know, the holistic approach is self-management. It's self-management. Of course, a lot of things that happen to us women, we need to actually manage it ourselves. There's something that Igbos say, which I'll tell us here. They say, Onyekwe chiekwe. Onyekwe chiekwe. It's like, if you agree, your God will agree. If you agree that what is happening to you will not have a cure, ultimately there won't be cure for it. But if you agree that what is happening to you, that there will be a cure, that God will heal you, you will finally be healed concerning it. So if you know anyone who is having this fat disease called lipedema, just encourage them. We're going to be looking at some of the ways, you know, that one can handle it. And if you're the one it's happening to, then you also need to agree and know that there is solution. That with God all things are possible. You know, because of the experience of lipedema for different people, they are unique. We always advise all-encompassing, you know, approach for each woman. And we believe that the holistic and individualized approach to treatments is required for the best outcome, because like I said, the symptoms differ from women to women, and a personal protocol for management can be developed by exploring some domains which I'm going to discuss with us this afternoon. 5 domains: the physical domain, the mental and psychological domain, the emotional domain, the spiritual domain, and the social domain. So those are where we are going to be looking at. Hello Enoeti, you're welcome. Eme Asiak. Folayemi Ekoja said today's broadcast is for me. Oh, my weight is increasing. I'm presently weighing 104. Don't worry, you will be okay. If you agree, it will happen to you. Let me tell us, determination, passion, consistency is the thing. You will just lose that weight. If you speak to even the weight, you'll find out that things will happen to bring, into action that can help you. So let's look at physically. We're looking at the 5 domains, and then I'm going to take step by step to tell us today. I just pray that time will permit me. If you stay to the end, that's the last place we're going to treat this afternoon. We'll look step by step. The foods, I'm going to read out the foods you must avoid, the foods you should take, and the foods you should reduce. I was thinking I'll break this broadcast into 2, but I just felt giving somebody 1 week gap to a solution is not the best. We have looked at what the disease is. You can go and watch the replay if you need to watch it. We have looked at that disease called fat, lipedema, fluid in the fat. And then what causes it? Obesity is part of it. When you are adding weight too much and fat deposits are coming, then there's bound to be that. But when you're filled with strong and firm muscles, you're not likely to get that, even when you're passing through all those hormonal changes. So number 1 is physical approach. And this physical approach domain includes management of physical symptoms, management of, manifestation of the lipedema, including the pains, the swelling, the fibrosis, the bruises, the fat deposits, as well as also the secondary consequences such as reduced strength, endurance, and mobility. Those are the areas that will be handled, by the physical means. Because like I told us, when it continues, one begins to become, the pain will make people not to move about, and then immobility comes, and then more fat deposits, then reduced strength, all this come with it. So effective treatment should actually incorporate nutrition and complete decongestion therapy. They have also manual lymph drainage therapy, compression therapy, and movement and exercises that one can actually use. On Saturday, we are going to be looking at some exercises that people with lipedema should do. And I'm going to be, if possible, I pray, where I am, I'm movement, all this my trip. I'm actually in Germany today. I'm broadcasting from Germany. I'm broadcasting from Mainz. Mainz in Germany. So wherever I'm on Saturday, I'll try to be sure I show us the practical exercises that one can use. So then women are also counseled to adopt a diet adapted for lipedema, which I'm going to be sharing finally here today, which also is unique to them depending on what you find around you. So those are the physical domain. Remember what I said about the physical domain: handling the pain, the swelling, the fibrosis, the bruises, then the secondary outcome of lipedema, which is like reduced strength, reduced endurance, and reduced mobility, being able to handle it very well. All right, so the next one is the mental or psychological. Yeah, thank you. Welcome, Ibrahim. Welcome to this afternoon's broadcast. All right, so also mentally, lipedema affects all aspects of a woman's senses, the self-dignity, especially in the light of, the weight bias in our culture. Today, when somebody is overweight, it's like, maybe because of the health issue, and also because many people like lanka when they are looking for Miss World. Of course, the type of people they look for. lanka So all those mental and psychological issues that come with fat people is there. Then the mental self-chatter and psychological impact can also be detrimental to developing a sense of self, nurturing to come out of it. So the intervention will include psychological flexibility, self-compassion, and broadening social connections. So one needs to focus on change to mental self-judgment. I can remember one of my daughters that will always tell me, you see, it's a natural endowment. We need to look at ourselves first of all and agree that we are fearfully and wonderfully made. There are some people that their fat is nature. And that's why if you know on time, you start watching it from time. But even if you have become fat, you need to work on yourself mentally and psychologically first, so that you will be able to have the energy and the strength to reduce that weight. If you don't have that energy, you will not be able to do it. So you need to focus on self-judgment. Don't judge yourself. You see, when there is a problem, let's not dwell on the problem. Let's dwell on the solution. So what you tell yourself every day, yes, I'm overweight, but what is the solution? What is the way forward? Don't begin to feel bad. Look at the dresses you wear. You don't go to some places because you're fat. No. Solution. Then make sure you don't criticize yourself in a way that you're not being positively, looking for the solution, and then blaming yourself. And then, that kind of internal self-hatred, will now begin to occur. You begin to wonder, why did I do this to myself? I know a girl that she ate a lot when she was very young. So by the time she now entered her childbearing period, all those fats, they all came up and she was bloating. She couldn't just help it. She had reduced her eating and everything, but that thing was still coming. So she now started blaming herself and now started going into depression and things like that. So remember the 4 ways that I'm talking about: physically, mentally, and psychologically. And then number 3, emotionally. The emotional impact of lipedema with its physical disfigurement and functional limitation can be confusing. It can be really, really confusing, because at that stage, you're doing all your best for people who have it, but you're not losing that weight. So since the self-blame is reported and are the most constant issue, a gentle and methodological approach, should be used. So you need to work on your emotion. Develop a way of identifying the feeling and emotion that influence all aspects of your life and decision making, and allow a pathway to accept the fact that that thing has come, that circumstances is there. What you're looking for now is the solution. Solution. Hello, Ngozi. You're welcome to this afternoon's broadcast. We're looking at that disease called fat, Lipedema. So you need to look at solution. Now, when there is a problem, don't dwell on the problem. Emotionally, come out of it and look for solution. Believe that there is a solution. Work towards the solution. Do everything to search for solution. Don't allow your emotions to be down. Don't allow yourself to be down. Don't even compare yourself with another person, because all those things will make you to begin to feel bad, and then you will wonder what is happening to you. And then the fourth way we can handle and reduce and come against and manage lipedema is spiritually. Let me tell us something. All the things that is happening to you, my husband will always say that every situation can be controlled, can be changed by spiritual force. And even medicine these days, they have reviewed many ways of handling some sicknesses, even this lipedema, and it's painful, the pains across the domain, the physical, the mental, and the emotional. And they found out that pain is inevitable. Suffering is optional. Pain is inevitable, but then suffering in your pain now depends on you. Now you're sick, you're having that pain from the sickness. You don't have to suffer. You only suffer when you allow your emotions, to go into it, and then it's now going from that physical pain you're having to emotional sorrow, emotional suffering. So there has to be a kind of cultivation of self-compassion and mindfulness contributing to spiritual dimension. Where is your Bible? Pick up your Bible. What did the scriptures say concerning healing? By the stripe of Jesus we are healed. What did the scripture say concerning diseases? That none of the diseases of the Egyptians will come your way. What does the scripture say? that, you know, God loves you, and that the thought he has for you is of good to give you an expected end. So there has to be that kind of self-compassion. Love yourself in a deep way. Love yourself, and don't love yourself into suffering. Be mindful of what you're going through and confess positively. I remember a story they told of a woman who had a terminal cancer, and the doctors told her to go home and die, that there's nothing they can do about it. So she went home. What did she do? She went, because she was a Christian. They had told her that she will live just for, like, I don't know if they say 2 weeks or 3 months. I don't remember the time, the dates now. So she wrote scriptures from the Bible of all the things about healing. You know, by the stripe of Jesus, I am healed. Healing is the children's bread. You know, none of these diseases will come your way. You know, the thought the Lord has for you is of good to give you an expected end. That, but you know, she wrote all those scriptures and she put it where she will be looking at them every day. If she wakes up, she will look at them. If she's in the toilet, she will look at them. If she's in the sitting room eating, she will look at them. Everywhere she was looking at them. She kept confessing it. This is the woman they say we died maybe within 3 months. That woman lived for like 7 years or more. She lived long, or she became very old because she handled the situation. Every situation can be changed by spiritual force. What are you doing concerning your, even if it's arthritis, diabetes, hypertension, no matter what it is, you need to cultivate that awareness that it is you that determines what finally happens to you. Medicine, medication, drugs, and all this will do their best, but you're the one that will determine what happens. So you need a quiet time. You need a meditation time. You need to practice mindfulness and thankfulness and heart of gratitude to support yourself, so that you will be able to develop that self-compassion and depending so much and deepening spiritual growth that can help you to withstand the situation. No, let me tell us, sickness is not easy. It's not easy for anyone, not even if you're the one or you're taking care of somebody that is sick. So you need that spiritual aspect, you know, to help you. Then socially is the fifth one. You know, lipedema people, when you have lipedema, you feel alone, and the person feels like, you know, you're struggling alone. You know, that people will look at you and, you know, they will wonder. When you pass, when people with lipedema pass, people will always turn and look at what's wrong with that person, you know. So there's this kind of social trauma, as if the person is being on his own. Also, you need to also work on that. Let me tell us, there is no sickness that is sweet. Some people are suffering from worse than what you are going through. There are people who have terminal diseases and they are laughing and going about the street and talking to everybody, but because it's not showing on their body, you know. So don't allow your own to now become something that you cannot manage. You need to be very, very careful. Then again, there are some lifestyle changes that can help. Like I said, diet is one of them. We're going to be looking at that very, very, you know, comprehensively very soon now. And then exercise is another one. And I said on Saturday, we are going to be looking at exercises that can help people with that fat disease. You know, walking, swimming, biking also can help to reduce the painful symptoms. Now, they also have what they call the compression garments. You know, these are tight garments that can, you know, kind of provide reliefs. You know, they are not too tight or painful, but they have them. If you Google, you can find where you can buy that. And then they also have the physical and occupational therapy. Patients can learn how to do manual lymphatic drainage therapy. They also have that therapy. We are not going deep into all these treatments, you know, now. And they also have one kind of stretches and massages that can also help. If one has this disease, you need to visit the hospital, especially if it has reached the stage 2, to be able for them to actually manage it. But for stage 1, you can use diet and the rest to make sure you get out of that weight. Then they also have what they call the liposuction. You know, some doctors will use water jet to disconnect the fat and prevent damage of the lymphatic vessels. You know, the doctors also do that one. They have so many medical ways that they can handle that. So it's better whoever that has it to visit the hospital, and the doctors will tell them what to do. Then also you can try not to be intimidated. you know, even by the doctors when they call you and tell you that they can't, it's something that cannot be handled and the rest. Keep searching until you find a doctor that knows about it, because many doctors really don't know much about the lipedema. Then also that we are going to be looking at diet, recommended eating pattern for somebody with lipedema. You need to eat whole foods, mostly plants, including a wide variety of rainbow colored vegetables and fruits. You need to go on rainbow colored vegetables and fruits in your meal. Take vegetables with so many, you know, colors, what we call rainbow colors in each of your meal. You make sure you have all those different vegetables. That's like you go on your cabbage, white, green, purple cabbage, green lettuce, you know, things like that, you know. And then you go on fruits of different colors. Usually people who have lipedema are not advised to take one particular fruit at a time. You take fruits that are in groups, that are in the same pH level but different colors, or foods that are in different pH level. And then fermented foods are also advised. Then a lot of herbs, spices that with different colors. Then you also need to, another thing generally, we're looking at generally, I'm going to read out most of those foods before we end today. You need to start the lymphedema and lipedema by avoiding added sugar, especially fructose, refined grains, you know, especially grains with gluten, and chemically modified fats, that's the trans fats. Then you need to also limit animal products and high salt food. You know, you need to avoid dairy. You need to avoid it. There's only yogurt that they are advised to take, the dairy product that they are advised to take if somebody actually has lipedema. Then whole foods are best because most prepared food contains added sugar. I always tell us this. And soy, salt, unhealthy fat, undesirable, addictive, and even juicing is not good. Juicing your fruits and vegetable, if you actually have lipedema, it's better to eat them wholly. It's better to eat your food solid and eat them wholly. Don't juice, because you know juicing breaks down fiber, removing an important nutritional and digestive health benefit when you juice. Then fruit juices should be minimized because they also raise blood glucose level more rapidly than the whole fruit. I always tell us, don't drink your calories. That's where it appears. Now, like I always say, if you take, for example, you take 5 oranges, you hardly finish 5 oranges without being full. But if you take a bottle of juice like this now, you can drink it within 3-5 minutes, and yet it can contain 20 oranges and the fibers have been removed. So you're not doing yourself a favor. So modify these eating patterns. If you're taking a lot of carbohydrates, or you're allergic to some foods, you need to watch your diet and look at the foods that are grouped in a way that you can take them. For example, foods that are recommended for us to eat primarily foods that are from different, you know, lists every day, like I said, and reasonable serving sizes. Remember your portion control that I always talk about, you know. So include maybe like half cup of beans, half cup of whole grain such as oats, and then just a starchy vegetables and a cup of fruits for each day. So do your portion control and make sure you take it. And remember, one thing I said is avoid animal protein. Then you also need to eat in limited quantity foods that are, you know, foods best enjoyed in smaller amounts and only a few times a week, not every day, including, you know, not more than 4 to 6 servings of animal proteins each week. So it's not the one that every food you eat, you go and look for meat to eat, look for fish to eat. No, you have to limit it to certain days. And then you need to know the foods that you eat occasionally. So I'm going to run through this now, and then we call it a day. I have 9 minutes more remaining. So eat primarily, I'm going to read it very fast, vegetables with bright colors and flavors such as dark green leafy vegetables, tete, ewedu, shoko, Ugu, very good, colorful. And those of us who have access to spinach, kale, you eat that. Eat beets. Beets is very, very good. Beetroot, very, very good. Then corn, the corn with the whole corn, not the one that you have made out to become like pepper. All types of pepper, very, very good because of their color and their flavor. Onions, fantastic. In fact, I always tell people I have removed Maggi from my food and I replaced it with onions. I replaced Maggi with onions. Garlic is very, very good. Mushroom is very, very good. Herbs, like parsley, all those herbs, what do they call it? Scent leaves, they are very, very good. Then beans, very, very good. Legumes, very, very good. They are very, very good for you. All types of beans are very, very good. And then I don't want to start naming the beans, maybe like what type of beans that you have. All those beans, kidney beans, lentils, lima, normal brown beans, they are all very good. Then berries are very, very good. Blueberries, blackberries, cranberries, raspberries, strawberries, very, very good. Citrus fruits, grapefruits, oranges, they are also very good. Then fruits like apple, bananas, cherries, grapes, kiwi, mangoes, melons, pawpaw, peaches, pear, pineapple, they are good. But remember, take this in moderation, especially those fruits that are filled with much sugar. Then potatoes, very, very good. Red potato, purple potato, they are not very, very starchy. They contain complex carbs, so they are very, very good. Sweet potatoes, very, very good. Yam in smaller quantities. Grains, whole grains, very good. Like and if you want to take rice, brown rice, please go on brown rice, not the polished rice. It's not good. Millet is good. Oat is good. Sorghum is good. Wild rice is also very good. Then fermented foods are very, very good. Any food you make to ferment before you take it. I can remember when we visited Korea, they take a lot of fermented foods. Even their cabbage and pepper, there's a way they do it to ferment it overnight before they take it. You can also take fermented soya beans, tofu, you can take it. Remember what I said, if you're taking milk, no dairy milk, but you can take like almond milk, coconut milk, you can take that. Then green tea, very, very good. Cocoa, unsweetened black cocoa is also very, very good. Then what you should eat in limited quantity. Some nuts you should eat in limited quantity, like Brazil nut. Eat chocolate, dark chocolate in limited quantity. Not normal chocolate, but dark chocolate. Remember I said dairy. Don't take dairy that are from animal. No butter, no cheese, don't take all that. Then egg, including the yolk, you take them in limited quantity if you have lipedema. Meat, avoid meat. You can eat a little of lean meat without fat occasionally. Even poultry occasionally. Remember what I said, maybe like 3 to 4 times a week. Nuts and seeds, almond, cashew, hazelnuts in little quantity. Oil that you should use should be extra virgin oil, avocado oil, walnut oil. Those are the oil you should use. Sesame oil. And then salad dressing, avoid all salad dressing. Sugar, throw it away. Condiments like chili, pepper, hot sauce, pepper, you can use all that also in moderate quantities. Then the things you should never take if you have lipedema are grain products containing gluten. If you have lipedema, you need to avoid gluten. Avoid bread that they baked outside. Avoid breakfast cereals. Avoid cakes and cookies. Avoid Costco. Avoid cracker. Some people take cracker biscuit. They think they are taking something healthy. Avoid cupcake. Avoid noodles. Avoid pancakes. Avoid pasta. Avoid meat pie. Avoid pizza. Avoid waffles. You need to go out of these ones. Then gluten-free food substitutes, bread, pasta. Avoid all those ones. Fried food, like chips and crisps, fries and Pringles, all those ones, please stay away from them. Stay away from processed meats like sausages, ham and all that, stay away from them. Stay away from meat substitutes. They are not good for you. And also some of those soy products that are produced outside because of the gluten, you need to stay away from it. Stay away from any snack that is made with sugar. Stay completely away from it. Stay away from sweet drinks, minerals, all those things they make. They call it yogurt. They've put sugar, they've processed it. Stay away from it. Stay away from hydrogenated oil like palm oil, palm kernel, polyunsaturated oil, all those vegetable oil that they sell around. Stay away from it. Of course, stay away from alcohol. All types of alcohol, they are not good for you. Wow. So I'm going to take our questions now, and then remember, if you want to join the arms fat the arms fat reduction trimming chat room, we're starting this evening. You can go ahead and click the link that I'm going to drop on the cover note as we stop this video, and join the link, introduce yourself and ask your questions, and then we will start this evening. Do I have any question from anyone before we call it a go? Hello Folayemi, you're welcome. Welcome Ozonwane. Welcome Kemi. Welcome Anne. We are all welcome to this afternoon's broadcast as we were looking at that disease called fats. That is what we have looked at today. The disease they call fat, Lipedema. Lipedema. Thank you all for joining me, and I'm going to be dropping the link soon so that those who need to join can join. Thank you for Layemi for thanking me, and thank you for all those who share this broadcast with friends, with those who need it, and those who comment, and those who also buy products from me. Like I said last time, if you need any product, chat me privately, and then you can get it. Like for those of us in the arm streaming room, we're going to be needing aloe vera gel, we're going to be needing Garcinia, we're going to be needing Forever Lean, we're going to be needing Forever Thyme or Forever Proline. And then for those people who are having lipedema that need energy and strength, you can private chat me and I'll tell you what you need, to get. I don't want to talk about supplements for it, because you first of all need to find out your stage, the stage of the lipedema, and find out what can be you can use medically, and then some supplements that can help you. Thank you for joining me once again today. I love you all. Keep high in the spirit. You are fearfully and wonderfully made. God loves you. Love yourself, and make sure you speak positively to yourself. Hello, Sister Stella. You're welcome. Welcome to this afternoon's broadcast. Somebody is asking, can you take red wine? Well, alcohols are not good, but if you must take red wine in moderation. Somebody is asking, is basmati rice for Weight Watchers? Brown rice and white rice better. Basmati rice in small moderation. Remember your portion control. Very, very, maybe like once a week. It's not that I don't ever take white rice. I take it maybe once in 2 weeks, once a week. My basic food is sweet potatoes, garden egg, amala, vegetables and things like that. But when it comes to some of these things, once in a while, of course, if you go to parties and they give you food, you're not going to be running away from it. Just add plenty vegetables and make sure you take your aloe vera to detoxify after you have taken what you're not supposed to take. Yes, red grapes are good for some people, but for people with lipedema, remember what I said, berries are better. Berries are better. So if you have lipedema, it's better you go on berries and not grapes, because of this fructose, the sugar content in it. Any other question? Oh, okay, thank you. Who is saying I'm grateful? I think I'm having delay on my phone. I can't see the name of the person saying she's grateful. Let me see. Okay, Emma, thank you for appreciating. All right. Okay, somebody say, can you take energy drink? Paul Modupe, please. It's better to take natural source of energy, not all these energy drinks that are filled with added sugar. Remember, all those ones are filled with added sugar. Paul, if you need energy drink, I have energy drink that you can take that does not have added sugar. Okay, you can chat me on that, but don't take all these ones that are filled with added sugar. They are not the best for you. All right, I think that's all the questions I can see. Thank you for joining me once again. I love you. Bye. And make sure you join the group if you need to. And if you know somebody who is suffering from Lipoedema, give the person my number and I'll be chatting with the person more. Folayemi is asking what is Lipoedema. That's what we treated today. Watch the replay from beginning to the end. You will understand. Folayemi, you must just be joining us. That's what I have treated for nearly 1 hour. I can't go through it again, but it's generally and summarily fluid in the fat. Okay, thank you all. Bye. Love you all.